Welcome, everyone. Thank you for joining us today. In this session, we are gonna walk you through what the CPT program is, its requirements, the overview of the application process, what the program covers, the support services that the program will provide to the participants. And as well, at the end, we're going to have a QA part for you to get your questions answered in real time. As well, in the meantime, please feel free to share them if you want in the chat. And we will, or if you want, we will prefer if you share your questions by the end so we can address the question at once. But if you want to, you can as well use the chat. If you have a very specific questions regarding, because your case might be very specific, please feel free to send me an email. My name is Ilonka, Ilonka, Stoll. I'm going to put in the chat. I think that will be faster. So if you have any specific questions, please feel free to send me an email, and I'm going to be more than happy. The CPT team will be more than happy to connect with you and discuss your personal case. Well, let's start our session today. As I mentioned, my name is Ilonka Stoll. I'm the CPT Participants Manager. Right now, here as well is in the meeting is Kathy McGuinness. She's the Workforce Director. And we have as well May Standenmer. That is part of our team as well. So if you have any questions, please feel free to share them, and we will do our best to answer your questions in real time. Well, so today we're going to be talking for what is the WIO, a quick overview. We are going to talk briefly about what is the 1115 waiver. The 1115 waiver. What are the next steps if you decide to apply for the funds, the CPT program? And at the end, as I mentioned, we're going to have a section for QA, questions and answers. Next. Thank you. Well, FLIPS, we have been, was established back in 2015 as part of New York State's Delivery System Reform Initiative Payment District Program. The mission at the time was to transform healthcare delivery for Medicaid and uninsured populations and improve the clinical outcomes across of the Western New York region, the 13 counties, and serving nearly at the time 400,000 individuals through a network of over 6,000 providers and 19 hospitals. Through the last 10 years, FLIPS has implemented multiple district projects related to behavioral health integration, chronic disease management, care transitions, housing, and as well, we have developed naturally what we call the NOCNs. This is the naturally occurring care networks to improve collaboration among providers in rural and urban areas. And basically, we have as well from day one, we have focused on providing education and training programs to strengthen the healthcare workforce, including career pathways for new entrants and as well advancement opportunities for existing workers. This has been done with the intention to address the workforce shortage and health disparities by focusing on underserved communities. We in the different programs, initiatives that FLIS has hosted through the last couple years, we have offering resources like tuition, assistance, mentoring, specialized training to build a reliable pipeline of qualified professionals in roles such as nurses, mental health counselors, and home care staff. Essentially the wheels are act as I think the flips, as I mentioned, is the New York State is one of the New York State designated workforce investment organizations, WIO, and is entirely approved by the New York State Department of Health to support workforce development initiatives, primarily in healthcare and long-term care sectors. The WE organizations like FLIPS, we are tasked with providing education and training programs to strengthen the healthcare workforce, including career pathways for new entrants and advancement opportunities. So for existing workers, we have two pipelines. And essentially, the wheels act as a regional administrators and training partners to ensure that New York's healthcare system has a skilled and sustainable workforce. As of today, we have about 5,000 participants, individuals that have enrolled in the CPT program and start their academic, and about 2,000 out of those participants have started their academic programs. New York's health equity reform, the 1115 waiver, it was approved by the CMS on January of 2024 as an amendment to New York's Medicaid section. In this program is intended $7 billion to be distributed in the over 3 years and 4 months. So basically through January 9, 2024 through March 31st of 2027. This is what has been done with the intention to transform healthcare delivery for Medicaid members and uninsured populations. Its primary goals are to advance health equity, reduce the health disparities, integrate social care with health care, and strengthen the workforce. The key initiatives include the social care networks, that is, as we mentioned before, that is the integration across primary care, behavioral health, and social care. Population health. We have improved health outcomes, advance in health equity, and reduce health disparities, improving financial sustainability and quality of care among the safety net hospitals. And well, here the last point, we have strengthening the workforce, funding education and participant support services to provide a holistic educational and professional placement support. That's where the CPT program comes in place. Next. Well, out of the 1115 waiver, it has been assigned $645 million for what is the career training program to help individuals in the advancement pipeline and in the entrance pipeline. Next. Thank you. Right now, in April 10 of 2025, the CMS published the federal position on 1115 waiver and financing through designated state health programs, indicating that they will no longer be approving these designated state health programs funding. The Department of Health, New York State Department of Health, has confirmed that CMS will continue to honor the terms of the terms and conditions through the remainder of the demonstration period until March 31st of 2027. That's the most important part here. If you want, we can share with you later the link to what is the waiver if you want to learn more in detail. But the most important part here is that the CMS will continue to honor the terms and conditions until through the remainder of the demonstration period, March 31st of 2027. Next. Thank you. Well, here we have the Workforce Investment Organization, the WIOS, for the state of New York. The state has been divided in 3 regions. We have downstate, basically New York City area. That is the region 1. And we have region 2, that is upstate. And then we have region 3, that is the Western New York. We are the designated WIO for supporting the Western New York area, region 3. This information is important to keep in mind because you need to, if you decide to apply to the program, you need to do it through the organization that is covering your region. For example, for a person living in Hudson Valley, in any of those counties, they need to, that's region 1, they need to apply through 1199. This is the other we as well, we can share with you the link to those organizations for you to start a conversation with them, and if you are interested, the application process through them, if you live in what is the downstate area. For region 2, that is upstate area, we have what is North County, Capital Region, Southern Tier, Central New York. This part of the state is covered by the Caring Gene. This is the second organization. And finally, we have region 3, that is basically Finger Lakes, Western New York area. If you live in any of those counties, you need to apply through our office, FLIPS, the CPT program. Next. Thank you. The Career Pathway Training Program was launched under New York's Health Equity Reform 1115 waiver. It is designated to strengthen the healthcare workforce by funding education, training, and job placement for both pipelines, new entrants and current workers looking for advancement. The goal is to create a reliable pipeline of health, behavioral health, and social care professionals to address the statewide workforce shortage in these areas. The program timeline runs until March 31st of 2027, with the service commitment extending through the end of 2034, 2031. And here as we mentioned, we have 13 job titles. We have the nursing titles, such as licensed practical nurse, associated registered nurse, RN to BSN, the accelerated bachelor's to BSN. I need to mention that we started with 13 job titles as the ones listed right now on the screen. Right of those job titles, we are not able to take new applications for nurse practitioner, certified pharmacist, pharmacy technician, physician assistant, and respiratory therapist. The reason for that is because any of the schools in partnership with the program can have confirmed that participants will not be able to complete their academic program by the end of spring of 2027. So for that reason, we are not able to take new applications in those 4 job titles. The other 9 titles highlighted in blue, yes, we still are taking new participants as there. It's very important that part of the program, after you complete your academic program, you are committed to a 3-year full-time commitment service and under the new professional title. So saying if you start under the LPN program, licensed practical nurse, that's your academic program, you are expected to work for the state of New York for Medicaid on a health provider or organization system that at least 30% of the population that they serve are Medicaid recipients or uninsured. So you are going to be working for 3 years full-time for these Medicaid enrolled providers. Next. Here, as we have mentioned before, we have 2 career pipelines. The career advancement pipeline. This is for individuals that are right now, currently, they are working in health, behavioral health, or social care fields, but they are interested in starting a new advancing in their careers. As well, we have the new careers pipeline. Thus is intended for individuals who are unemployed or not currently working for the New York State, for a New York State health, behavioral health, or social care providers. Then we have what is the CPT program participants receive. Is application and enrollment assistance. This based on the school that if you have not started, our case management team will work with you and support you through the application process to the academic program. FLIPS or the CPT program is offering full tuition coverage. Last dollar. We are going to explain what is the last dollar in the next slide, but please let's go keep in mind that the tuition coverage is done by the last dollar. As well as I mentioned, the program is offering educational case management. Our amazing case management team, they are going to be working with you through the application process through your academic journey. And as well, after you graduate, when you are going through the completion of your service agreement, they are going to be supporting you as well. And with the job acceptance. The program is offering as well tutoring services, apprenticeships and mentorships, and as I mentioned, employment placement assistance. Those are very important to keep in mind. So what is all the other program details that is very important to keep in mind? The funding is available only to individuals who have not yet started an educational or training program covered under the CPT program. As well as one of the program or the funds are intended for New York State residents. We have as well, as we have mentioned before, the CPT program funding is scheduled to expire by March 31st, 2027. Basically, by the end of the spring of 2027, all participants must have completed their academic program. So any incoming students must be on track to graduate by May or June of 2027. We know that the schools, because we are working for over 45 schools, the graduation dates are different dates. So, but basically they happen between May and June. The participants are required to complete a 3-year full-time service commitment at a New York State Medicaid enrolled provider that serves at least a 30% Medicaid, a population of Medicaid recipients and or uninsured individuals. The service commitment is expected to be completed by the end of 2031. Next. Well, now we're going to talk what are the program requirements. Basically, as you need to be a United States citizen under the healthcare, the Department of Education. There is some other there is a definition of what they consider an eligible for new non-US citizens. As well, we're going to be sharing with you that a website so you can read more in detail what if you consider that if you are not a US citizen. As I mentioned, you need to reside in the state of New York as well. You need to meet the second requirement that is essential, is meet all the educational or training program requirements based on the selected CPT title and course of study. This they can varies from school to school, but basically you have prior completion of educational programs, licensures, and or certifications that the school requires for that academic program. You have as well to complete, you have completed the training pre-services requisites or entrance exams if that's required by the school of your choice. As well, if as I have mentioned before, the individuals must be a New York State resident or reside within the bordering states like New Jersey, Connecticut, Philadelphia, Pennsylvania, Massachusetts, and Vermont. We understand that some of those we have because the geographic location, Yes, we have individuals that they might live in New Jersey, but they work in New York State. Just basically, they're crossing the borderline between states every day. They live in one state, but they do work in the state of New York. That could be an exception. Well, the bordering states. Then we have, we mentioned, they committed to a 3-year full-time employment at a New York State Medicaid enrolled provider that serves at least 30% of the population that they serve are Medicaid recipients or uninsured individuals. Some of those providers might not be included. That they include the ones that fall into the categories of health, behavioral health, and or organizations that are part of the established social care networks. Individuals can also meet the service commitment by working in a CSN, social care network, or a social care network contract partner. Next. As we mentioned before, the program funding covers what is the tuition, required program fees, exams, textbooks, scrubs, supplies. There might be required by the educational or training program curriculum. We offer is going to be covering the educational case support, case management, and academic support like tutoring. As we need to mention that there are some costs that the program cannot support, such as the room and board, meals, living expenses, and other incidental expenses. They are not covered by the program. Transportation or expenses related to transportation, such as parking, bus passes, is not being covered by the program, sadly. Technology like laptops or tablets, those are in electronics, are not covered by the CPT program. Background checks, if it's required by the school or by the program, employment application and the background checks are not covered. Vaccines, if your academic program requires vaccines, they are not covered by the program, the CPT program. The N95 fit testing is not covered by the CPT program. The CPR certification is not covered by the CPT program. Drug testing, no, is not covered by the CPT program. As well, any other stand-alone processes that are not part of the tuition, but might be required for programs and or clinical placements. Just please, if that happens, feel free to reach out. We understand that all schools, they might have the same academic program, but the requirements or their needs are different. So that's done by case. Next. When we were talking earlier about the tuition coverage and the last dollar, as well, we need to share with you that yes, one of the requirements is as well to apply for the free application, Federal Student Aid, FAFSA, and the Tuition Assistance Program, HAP, applications. You have to go through the process if it's applicable for your academic program. The reason for that, if you are eligible for FAFSA or TAP funding, great. If you are not eligible for FAFSA or TAP funding funds, great. We just need to make sure that you need to make sure that you apply for those two grants. What happens here when we mention the last dollar amount, because the CPT program is intended to be used only to cover any tuition gaps. So basically, you just talking an easy number, saying the program might be $100. The cost of the program is $100. From a FAFSA, you might have $50. There's what they are covering, and the TAP is $15. So basically, out of those $100, the CPT program will cover the balance left, that will be $25. So as well, our case management team, they could be able to assist you and help you through the application process if you need to as well. Okay, we have the program has a support services program, amazing. We have the areas, the categories that we provide support is basically case management, pre-training and academic program readiness, academic and training program support, enhancement and enhanced academic support, job readiness, and placement support. That this category is really important because, as we have mentioned, you are committing to work with the state for a health provider in the state of New York for 3 years full time. As well, we are offering language services that if the student or the participant needs any support, because the nature of our, if any participant, they need any services, improving their English language skills, we can support those needs as well. The other is we are offering additional support for non-academic services. And we could say that we can help you to connect with organizations that can help you to provide transportation, financial coaching, childcare benefits, navigation services, etc. The CPT program doesn't cover those needs, but we can help you to connect with organizations in your area that can help you to fulfill those needs. Next. And as when we were talking about employment placement, that's where you're going to be completing your 3-year full-time service commitment. We have saying a platform, and we have the job speaker. Basically, and this platform is intended for the CPT participants to use it to look for job opportunities. Basically, in this platform, you are going to find all the positions available at the time that with offered by Medicaid providers or health providers that they meet the 30% Medicaid and or uninsured population, that they serve those 30% of that population. So basically, in this website, you're going to be in this platform. You're going to be able to go and look for job placement. You're going to be able as well. as beautiful the technology is these days, you're going to be able to develop to create your resume, a professional electronic resume, um, based on your skills and your advancement. And it's not just for just that moment. It can be, you can keep it for as long as you want. So basically, it can grow as you grow in your professional career. We mentioned as well that yes, we are going to have listed for job opportunities within the state of New York for health providers that they meet the 30% threshold. We, as well, in this platform, you're going to be able to track what applications you have, what openings, job opportunities you have applied, what is the status or the outcome as well. Is going to be a very unique platform. And well, as we need to mention that you're going to have a AI power assistant, Sheila, that is going to help you to navigate the job speaker, is going to offer you instructions and is going to be able to respond in real time. Any questions that you might have regarding the platform, how to navigate it. Next, please. And well, now we want to share with you what the program participant journey. The first stage, the first step is basically you starts today. You decide if you're interested to apply. Right on our website, we're going to be sharing the CPT website address in a minute. You're going to start an interest form. Basically, we're just going to get the general information. When we receive that general information, we're going to invite you to, we're going to send an email inviting you to complete your account in Goku. That's the platform that we use for the application journey. So when you complete that, receive that email and you complete your onboarding, after you do that, is when you are going to move to the step 2. I'm sorry, that's the onboarding is step 2. After you complete the step 2 onboarding in the system, you're going to be immediately invited to what we call the pre-services needs assessment. That's the step 3. You're going to get an email and letting you know that is available for you to complete. In this section, you have the first is, I think, 6 or 7 steps. After you need to submit what we call the pre-services request. When you submit that information, your case manager is going to be reaching out for the initial contact. And then after that, the 2 of you are going to start working regarding the application process, checking the status if your paperwork is in place, if you are already in conversation with a school to be enrolled, or if you are trying to find out, you are looking for what school, what program could be of your interest. Our case management team will support you through that phase. But yes, we need you to submit that pre-services request. If you don't do that, the case manager won't be reaching out, and that will delay your application. So please, we always invite all our participants to keep an eye on their email addresses, because most of our communications go out via email. As well, when you are creating your account, make sure triple 10 times check that the email address that you are sharing in your account with us is active, there is no typos, and it has enough space to receive emails. The reason why is because if for some reason there is a type on your email address, the system is not able to capture that. And we might be sending the informations, but might not receive them because we have the wrong address. As well, if that email address, make sure that it's active, you have access at any given time. So you can keep up with the application process and the application journey. So as I mentioned, after you complete the pre-services request, that's the step 3, you're going to go through the step 4. That is when the case manager meets with you and is going to answer any questions discuss the eligibility to the program. When after that conversation takes place, the interview takes place, if you meet all the requirements and you are ready for applying for the program, here's when the step 5 comes in place. An application form per se is going to be shared with you through the GOCO. And as well, you're going to be shared with you the participant service agreement via DocuSign. When those 2 items are received is when you move to step 6 after you submit those items. And internally here in the office, the administrative team goes through what is the application assessment. They're going to review your application and confirm that you have signed the service agreement. Both items need to be completed and submitted at the same time. So the application itself can be reviewed and processed. The timing may vary. It will be depending on if your application meets all the program criteria or requires additional information or review. So we cannot say that the application is going to take X number of days. It all depends. The application journey basically depends on your responses. It's on your hands. Next, please. As today, as January 4th, we have 1914 enrolled students already that they are attending academic programs under the 13 job titles that the CPT program covers. Next, please. As I mentioned before, we have a list of 45 schools, or 43, over 40 schools that they are in partnership with us. They are taking CPT participants. Each one they offer the academic programs. Each one of them has their unique requirements. So the schools that you see in front of you and on the screen are the schools that are in contract with the CPT program. We are planning to continue. We are set to continue the partnership with these schools through the program. We invite you as well to visit the website, the CPT program website, where all the schools are listed and the job titles or academic programs that are under each school. And next, please. Thank you. And then, thank you so much for your attention and your time. Here on the screen, I'm sharing with you what is the CPT program website. It's healthcarecareersnow.org/CPT. Here in that website, you're going to see more in detail all that the conversation that we had in this morning. The list of schools, programs, academic programs. As well, if you want to visit the website using the QR in this screen, you can. But you are going to be you are going to be redirected to our website as well. And within the website is where you're going to start the application journey by completing the interest form. After that is completed and submitted is when you start your journey process as well. For general questions, please feel free to send it to the cpt@flips.org. Or if you want, please feel free to reach out directly to me. My first name, Ilonka, _ my last name, Stoll, at flips, FLPPS.org. And well, let's go start with the questions. Please let us know if you have any questions.
I have a couple of questions.
Mhm.
And if I just need to fill out the contact form, I completely understand. So, my questions are surrounding a couple of different of the pathways. So, is it that in because I'm actually kind of struggling between which one I would like to go for. So, if I were to fill out the interest form, then would I be able to like talk with somebody about which one may best suit me, or if maybe I don't qualify? Because as far as I can understand, for the LMHC, that would be like a master's program, which would not, you would not be able to graduate that by 2027.
Well, for LMHC, we have some of the schools that they still have that program. Is kind of an accelerated program, and as well, if you have, it's possible. It depends of the school. You might have credits from your previous degree that can be applied to the program. But just please start your interest form. Then we're going to invite you to complete your account in our system in GoCo. But after you do that, you're going to receive the pre-services needs assessment, and you need to submit the pre-services request. Then, after that, the pre-services request is received, our case manager is going to reach out, and the two of you can have this conversation regarding your options.
Okay, thank you so much.
You are very welcome. All questions are good questions, and we welcome the questions. Feel free to let us know if you want in the chat or in the
So I have a question. Once you completed the GoCo, the onboarding for that, um, I haven't like heard anything since I did that. I actually did that some time ago.
Okay. I'm gonna take your name, and I'm gonna after this session, I'm gonna look you up in the system and see what's going on. Okay.
Okay.
And if you don't mind, can you send me an email so I have your email address and we can connect directly?
Yes, I'll do that now.
Okay, perfect. Do you remember around when did you complete your interest form?
Um, no, it was a while ago.
Okay,
Um,
no problem. Just I'm gonna look you up in the system, look and see what is going on, and I'm gonna communicate with you
okay.
directly. Okay? Thank you, Shakona. How do you say your name?
You said it right, Shaquan.
Oh, thank you.
I have a
Beautiful
question too
name.
about that.
Mhm.
So I did start the process and did do the GoCo, like got a GoCo account, but it seems like it's stalled because I'm not getting like any further responses. So who is there like a person I could talk to about the GoCo account?
Renika, don't
Mhm.
worry as well. I'm gonna do the same thing. I'm gonna look you up after the meeting, this meeting,
Okay.
and to see what's going on. The email address in your account is a valid email address? Is this one that I can use to communicate with you?
Yes. Mhm.
Okay. I will do the same with you,
Okay.
Shaquana. I'm gonna respond based on the email address listed in the account.
Okay, thank you.
You're welcome. Thank you.
I also submitted an interest form a while back and I never heard anything. And I kind of want some guidance on the application process. I've looked through and it seems like it would be difficult to finish a master's degree in 1 year. So I don't know if I should be looking at some different option. And yeah, if there's someone who could help me figure out the best approach.
Perfect. As the same as with Shaquana and Renika, we're gonna look up your account, see what is the standing, and communicate with you the status or help you to complete the onboarding. And then after we receive your pre-services request, we're gonna be able to connect you with the case manager, and they will be able to address your question
Okay,
and
great.
provide guidance. Okay?
Okay, thank you.
Thank you.
I sent you an email and I just put CPT program in the subject line so you know, and
Perfect.
tuition assistance, Ms.
Yes.
Lottie.
Thank you so much. I appreciate it. That will help me to keep it in mind. So anyone, you have any questions, feel free to send me emails and we are gonna be happy to work with you and help you through the journey process, the application process.
Hi, I have a question. How are you different from just applying to the school directly compared to going through your service?
Okay, the actually all participants, they need to apply to the school because
Hmm.
the schools are their own entities.
Hmm.
When you're approved, accepted by the school, we are going to be, and you're accepted by the CPT program, we're going to be able to pay the last dollar on your behalf to the school. So you have to apply to both places.
Okay. So if you're going to pay the last dollar, what if your FAFSA and your TAP covers for it and we don't need to get the service through you guys for the tuition? So I'm still not understanding the dedicating 3 years. If you guys are kind of doing the same thing that the school would do. If you go to school, you'll get the counseling help and the mentorship too.
Well, we will as well. We will cover whatever the last dollar. We are offering tuition, I'm sorry, textbooks, uniforms, any supplies that you might need for your academic program, as well
Mhm.
tutoring services. The difference between the tutoring services and the school's tutoring services, we can offer you from what is online and one-on-one with a tutor of if you need it. Right now, the price of higher education is really, really high, and it's a few exceptions, really few, that you are able to cover all the expenses through FAFSA and TAP. If that's the case, you are correct. It doesn't having a 3-year commitment. Is something for you to evaluate. But if you want to start your professional life after you graduate with no debt, this will be an option, the program, the funding.
Ilanka,
Do
can I
you?
also add just that, Jayla, many of
Mhm.
the programs, even if you got FAFSA and TAP, there was still quite a lot, depending on what program you're choosing. So, CPT would cover what the FAFSA and TAP would not. And in many instances, that has been kind of a saving grace for people to be able to complete their degree without incurring a lot of debt afterwards.
But do you have special spots for students going through your program compared to like the students just being physically in school?
Well, some schools, they have programs in person. Some of the programs are online, and some they have it, the model is a hybrid. They might have classes in person and classes online. We cannot assure you that you're going to have a placement in the school because each school, they might have number of seats available.
Mhm. Mhm.
What we have noticed that most of the online programs, there is no limit, basically, because it's different than being in person in a classroom. So that will depend on the school and the program of your choice. We cannot assure you that because you have been actually to be approved as a CPT participant and granted the funds, you need to be enrolled and accepted by the school first.
So
Okay.
I have a question too that goes what she just asked you. So I got accepted into one of the colleges, Brian Stratton, but they told me that they don't accept the CPT program or the CPT program isn't paying.
What program are you
It
applying?
was I had applied and got accepted to their nursing program.
The nurse practitioner?
No, their RN
It's the
program.
LPN program, correct? Because they told me the
No, the
same
RN.
thing.
It was the
Darren,
RN
okay.
Yeah, it was the RN program. And they said that you guys aren't covering them for the nurses, for the RNs.
Let me double check on that because from the top of my head, I have it like yes, but might not be, we might not have for the term. The same, like maybe because the duration of the program, if it extends after the spring of 2027, we might not be included. But if you let me a quick question, I'm gonna look it up. Okay, we have a program with the Brian Stratton RN to BSN is the
Okay,
program?
no, it was just the BSN. So you have to already have the associate for RN to BSN. So you're not doing the RN BSN program. You're doing RN to BSN, not RN.
Correct.
Okay. Okay.
Correct.
Got
Yes. I'm sorry. I was thinking about the RN to BSN, but you are
it.
just
Right.
registered nurse. Yeah,
Referring to.
sadly, yes, that's correct. We don't have the RN through the through Brighton, Brian and Stratton. I'm
At
changing.
some point, do you think that this grant will be extended or it will be indefinitely over after spring of 27?
To be honest, as of today, there is no conversations of any extension, but any things might change. It's all for us to keep an eye. We cannot say yes, it's going to be extended, and as well we can say no, it's not going to be extended because that will depend on the federal government to decide if there is an extension or not. Any other questions? If you want, I can stay online if you want to just chat after and with any questions directly, or as well, feel free to send me an email and we're going to be more than happy to work with you and address your questions, okay?
Okay, I was just trying to log into my Go, but I'll wait till you email me privately.
Mhm. It will be my pleasure. We really appreciate your time and your patience. So we're looking to work with all of you and support you in any way that we can. That's the goal of the program.